Good evening, all the aspirants present here. This is going to be a very interactive session. Please do initiate a conversation, answers, anything. Plus, you can even drop your questions in the chat box. And today's session is Endocrine Disorder. It is a CBS session taken by Dr.Fathy Elshazly, sir. He is a specialty registrar at ICM Northwest Deanery at NHS, England. Thank you, sir. So you may start.
Can you see my screen, Fatma? Could
Yes,
everyone
sir.
see my screen? Okay, thank you. Okay, good evening, or everyone, wherever you are. I know there are different time zones. I was asked to do another session on CBS of endocrine disorders. Although we covered most of those disorders last session, so in this session we'll continue what we didn't cover last time, and at the same time doing more CBS cases and a little one or two short cases, to see it, at least to cover everything they might ask about regarding the endocrinology and metabolism. Of course, your participation would be much appreciated. We'll start with case 1. Any volunteers? Any volunteers who might want to answer this question?
Okay, sir, I will try.
Okay, Dr. Muhammad, yes, please.
A 48-year-old asylum seeker lady, I don't know asylum seeker what means. Lady is brought to the emergency department confused and febrile with a heart rate of 140 and a blood pressure 220 by 97. She appears mildly cachectic. Her blood tests and are presented below. What is your differential diagnosis? Bicarbs 23, urea 18, creatinine 253, glucose 11.5 millimole, TK 560, calcium 2, phosphate 1.3, magnesium okay, lymphocytes 0.5, mean corpuscular volume normal, MCH okay.
So I know that some of you are not familiar with the creatinine and urea, but both of them are high. I know this units, some of you are using milligrams. So, Dr. Muhammad, what's your differential diagnosis from the data provided to you?
So this patient has acute kidney injury, have diabetes mellitus, and have severe hypertension. So this patient, it doesn't. They didn't mention she is pregnant, huh?
15 minutes.
Then I'll do my class.
Hello.
So, Dr. Dr. Sharma, would you mind just to mute yourself, please? Dr. Sharma, yes, thank you. Yes, you can continue. You can proceed, Dr. Murad.
So hypertensive emergency with acute kidney injury and thrombocytopenia. This can be what, TTB or?
Okay, this one of your differentials. What else?
Can be HELP syndrome with severe preeclampsia if the patient is pregnant. I don't know.
She's not pregnant. She's not pregnant, but it's a good differential diagnosis as well. What else? Pregnancy test is negative.
Pregnancy test is negative. So can be some this one breast syndrome of
breast. Okay. Anything else?
Some this thyrotoxic crisis or something.
Yes, thyrotoxic crisis. Anything else?
Cushing syndrome.
Cushing syndrome. Okay. Okay, it's a good differential diagnosis actually. So the differential diagnosis, as you mentioned, is thyrotoxic crisis, hypertensive crisis or emergency, acute pulmonary edema, heat stroke, malignant hyperthermia, sepsis, septic shock, sympathomimetic toxicity, tachyarrhythmias, pheochromocytoma. A lot of things that you said actually there in the differential diagnosis. So it's a good differential diagnosis actually. So and it's very good idea that you asked about the pregnancy test. Even a 48-year-old, they can get pregnant. Asylum seeker, it means that she's seeking asylum. She's immigrant and seeking asylum in a Western country. So obviously, I'm just mentioning here that she does, and as an indicator that she doesn't have access to good medical follow-up or good medical background, and we don't have a good history taking from her because of her current situation. So those are her. You asked for thyroid function test, and those are the thyroid function tests. What's your diagnosis and what are you going to do next?
So this patient is thyrotoxic crisis. 3T4 is high and TSH is very low. So this is
Could you just raise your voice, please, because you are
okay.
obviously
This
away
patient
from the mic. Yes.
is thyrotoxic
Thank
crisis most probably because T4 is very high and TSH is very low.
you.
Okay.
Okay. Yes.
So
Yes.
what to do next? We'll support the patient airway and breathing if not maintained, and then we will give a beta blocker. We'll try to reduce blood pressure and give beta blocker, and then we'll give anti-thyroid drugs like this thiuracil
Right. I receive. Yes. What
and
else?
propranolol and or IV beta blocker, huh?
Okay.
And
And the global thyroid. What else?
what's it took is this one iodine
Google's iodine. Great. Yes.
iodine. Mhm. I don't remember.
Okay. What about the temperature? She's pyrexial and feverish.
So we'll give hypothermic active hypothermia with
Okay. How we are
with
going to do the hyper?
cold IV fluid or cold irrigation of
Okay.
bladder, huh?
Okay. Are you going to use an NSAIDs or aspirin for her?
I don't remember actually.
Okay.
Okay.
Anything else? Okay, let's see the as you mentioned, ABCD is crucial here and should always start your answer with ABCD, including cautious IV crystalloids. Actually, those patients usually are hypovolemic. Although they have got heart failure, as you mentioned, but they are hypovolemic, so should be cautious. IV crystalloids should be initiated. Cooling measures, including antibiotics as a paracetamol, can be given. Cooling measures, usually the first step is the cooling blanket. And if not, they have here it's called Arctic Sun, some sort of cooling measure in which they are it's just like a cooling blanket, but just like a bandage which surrounds the patient's torso, abdomen, chest, and both lower limbs. They call it Arctic Sun. It's the name of the company, but this is a cooling measure they're using usually. And if the patient is really shivering, then they tend to might sedate them and intubate them actually in order to tolerate those cooling blankets, because we don't want the patient to shiver, and treat sepsis, because most of the time the thyrotoxic crisis, just like the myxedema coma, is secondary to or exacerbated by sepsis and specific treatment. You mentioned some